If you are suffering from erectile dysfunction or male weakness, you will hear so many things about it that you will get confused. Some are true, some are false, and most of the time, methods are told to manage erectile dysfunction. Ways to improve it are told, but no one talks about fixing it. Today we will talk about erectile dysfunction. To what extent is the use of Viagra effective in erectile dysfunction? What is the physiology of this medicine, and how can this disease be treated? Testosterone level is said to be the reason for erectile dysfunction, and it is said that if someone has low testicular and steroid hormones, then he is suffering from erectile dysfunction. But surprisingly, there are people who have high testicular and steroid levels, but still they suffer from erectile dysfunction. There are also people who have low testicular and steroid hormones, but they are not suffering from erectile dysfunction. See, testosterone definitely plays a role in erectile dysfunction to some extent, but there are many other aspects. A lot of data is present in this molecule in our body. It is found that our body itself produces it naturally, and nitric oxide is also found in some food items. It has been seen in research that with increasing age, nitric oxide decreases in the body, and in some studies it has even been written that by the age of 40, your nitric oxide decreases by 50%. Viagra reduces the nitric oxide pathway itself, delays and relaxes your blood vessels so that blood flow is normal and oxygen flow remains normal, because oxygen supply directly affects the functions of our body. Endothelial cells present in the blood vessels produce nitric oxide, and its deficiency relaxes your blood vessels. It reduces its production everywhere in your lungs, heart, and if you are a victim of it, then the reason for this is also oxide. If nitric oxide decreases, then less oxygen flows in your body, and due to less oxygen supply, you are not able to perform normal functions. In fact, those people who sleep their eyes, i.e. people suffer from shortness of breath while sleeping, out of which around 80% suffer from male weakness and erectile dysfunction. Another reason is the increase in cortisol hormone. This is a stress hormone which reduces the C pathway. When you are a victim of stress, your hormone increases, which also causes erectile dysfunction. The more relaxed your body is, the more sympathetic dominant you are, the less anxiety you have, the better your sex life will be. Erection or penis tension occurs only when your body relaxes, when your anxiety is less, and this is the reason why most of the men experience full erection after waking up, because at that time your body is the most relaxed. Your body is sympathetically dominant and not sympathetically dominated, which produces testicular steroids which help in the production of testosterone. This means that if someone has deficiency of nitric oxide, then Lakshman will also have deficiency of nitric oxide. The hormone reduces the amount of insulin released by the hormone, LDL, and controls the production of testosterone. You'll find nitric oxide everywhere in this treatment for erectile dysfunction. It improves your sleep cycle and the quality of sleep. This is why people suffering from these problems also suffer from erectile dysfunction. Another benefit of nitric oxide is that it increases insulin sensitivity. Diabetic patients with high blood glucose levels are insulin resistant and can easily develop erectile dysfunction. It's true that the insulin present in the blood of diabetic patients destroys the insulin present in the blood. The cells that produce nitric oxide are the ones that produce nitric oxide. Due to pressure on endothelial cells, nitric oxide is not produced, leading to erectile dysfunction. Now let's turn to the question of how to increase the production of nitric oxide and whether you can create it naturally in your body. The answer is absolutely yes. You can increase the production of nitric oxide naturally, breathing through the nose. It increases resistance by 50% and naturally boosts your nitric oxide production. Along with this, more oxygen enters your body and there is no oxygen deficiency. It is even better if you combine this with the next step, which is regular exercise. See, exercise improves your endothelial cells. We talked about endothelial cells earlier. They produce nitric oxide. You will get a boost in the production of nitric oxide and eventually your erectile dysfunction will improve. Number 3 is eating nitrate-rich foods. That means eating such things in the gym. Nitrates are found in them, and these improve your natural nitric oxide production. These include turnips, radishes, cabbage, parsnips, etc. These are high in nitrates. Along with this, you should avoid sugar and alcohol, because both of these things cause inflammation, damage your endothelial lining, and eventually disbalance your nitric oxide production. Sleep नींद के में यार, दे anxiety से दूर है, stress कम, लब